So as you guys probably know, I treat arthritis of the hip and arthritis of the knee. And I want to spend a couple minutes talking specifically about the only cure for knee arthritis. Do you know what it is? The only cure for knee arthritis is knee replacement. In another video, we'll talk about the treatments for knee arthritis short of surgery, but specifically with regard to knee replacement, it's the only thing that cures arthritis, and this is what I mean. Arthritis is the wearing away of normal cartilage, and once you're bone on bone, that's the end of the game. And the only cure is knee replacement. So what knee replacement really is, in fact, maybe a better term for knee replacement is a knee resurfacing. So what I do, I open the muscles kind of like an envelope. So we don't cut across muscles or anything like that. I open the muscles like an envelope and do all my work inside that envelope. And then at the end, of course, close that envelope back together. But knee replacement is really a knee resurfacing. So what I do is I remove just the damage into the bone. So off the end of the thigh bone, the femur, and off the top of the tibia, which is the leg bone, the lower leg bone. And I resurface both of those surfaces with metal. So a metal piece on the femur, a metal piece on the tibia, and then I put a plastic piece in between. That's like your new cartilage. So it can wear over time, and we can talk about that later on. But really, it's a resurfacing of the bone, the femur, tibia, with a plastic piece in between. Now, we also address the kneecap. So I actually treat the kneecap like an Oreo cookie. So I turn the kneecap over, I shave the back half of it off, place a plastic button on it, and then turn it back over. So after a knee replacement, when you touch your kneecap, that's your kneecap that you're touching. But the undersurface of it is a plastic button. So we don't want any bone hitting bone. Listen, we want good surgery. We want the parts to go in correctly and the knee to be well balanced. But maybe I could deliver the perfect surgery for you, but if we don't have the perfect physical therapy afterwards, you won't see that benefit. So even though I want to emphasize that it is a surgical procedure with risk and that must go well, we have to pick the right time for you to have such a surgery. After surgery, just as important is the physical therapy and the effort that you'll put forward. So let's get started. If you need it, knee replacement is the only cure for knee arthritis.